about how to get us from here to there, and his just persistence. And more important than all of that, the respect with which he is held in our caucus for his opinion has gotten us where we are today. Mr. Steny Hoyer, Democratic leader, Majority Leader of the Congress.
I want to thank my partner, the Speaker of the House of Representatives. Nancy Pelosi and I have worked side by side for many years to further the Democratic agenda, to make America better, to make sure that working families have the opportunities and the security that they want and they need. I want to thank also Jim Clyburn. I've known Jim Clyburn for all of my adult life. We started out in the Young Democrats together almost a half a century ago, working on behalf of civil rights in this country, making sure that every American was treated on the basis of his being an American, not the color of his skin or her skin. Jim Clyburn and I are proud to stand with Nancy Pelosi, who of course is much, much younger than we are, to take a vital step in ensuring that every American has the opportunity to have access to affordable, quality health care. We were addressed in this room, in this caucus, by America's first African-American president. How proud we were last November when he in Chicago stood and said about that woman who was over 100 years of age and the sweep of history that she had seen. She was alive when Teddy Roosevelt said, "We need health care for every American." Barack Obama, the man from Illinois, said, "We need health care for every American." And he said it to every American. And every candidate with whom he ran on the Democratic side and the Republican side said, "We need to reform health care in America." Today, we will reform health care for America in the House of Representatives. We will make sure that we reach out to make sure that every mom and dad in America knows that they will have health care availability for their child. They know they need that. That's not an option for them. It is a necessity for them because they love their children. We will vote today on the floor of the House of Representatives for not only all those children, but all those seniors and all Americans who want the security of knowing that they have health care and they can get health care that they can afford and that will give them the quality care they need. I now want to yield to the chairman of our Democratic caucus, who has held over 100 caucuses, to inform our members, to make sure they knew what was in this bill, and to indeed inform the public. John Larson of Connecticut.
Thank you, Steny, and what an honor to stand with this great leadership team. And more important, to stand with an unbelievable caucus who comes together today with the implicit understanding that what we're creating is something unique here in America. The combination of our great entrepreneurial, scientific, technological, and innovative skills with the commonweal notion that the growth of this great nation cannot be achieved unless we enjoin 36 million Americans who go without insurance. And by our action today, they will now have that dream and that commitment come true. God bless them. God bless America.
Javier Becerra.
The President of the United States urged us as Americans and as the privileged elected representatives of all Americans in this country to be on the right side of history. It's a glorious day to write a page of American history, and that's what we intend to do. I'd now like to introduce the Assistant to the Speaker, Chris Van Hollen.
Thank you, Javier.
This is a historical moment, and as the Speaker pointed out, it is the third anniversary since the day that the Democrats took back the majority in the House, and we would not be at this juncture had it not been for the confidence of the American people. And in the last election, the President and members of Congress running said, we're no longer going to sweep our problems under the rug. It's time to confront the main challenges we confront in this history. And just this past week, there were only 2 campaigns around the country where the questions that we're deciding here in Congress and the question of health care reform were at the center of the campaigns. And there were only 2 candidates in this country who were running who would have a vote in working with President Obama and the Speaker of the House and the Democratic majority in making a change in health care. Those 2 candidates were both Democrats, and the American people in those districts voted for both of them. And it was, in one case, a district where you had not had a Democrat for more than 150 years, about since the time of the Civil War, Bill Owens. And so those members are both here. They're joining with the President and the Democratic leadership to cast their votes today for health care reform. And those are the most recent votes and signals and messages sent by the American people on this very important issue.
Thank you. Thank you very much, Chris. Any questions?
Do you anticipate that the Stupak amendment will pass today?
Well, we'll see. I expect for it to be introduced. I think it's Stupak, Pitch, and Ellsworth. We plan to vote on them, and we'll see. I'm not going to predict. I think all of you know that I never give out numbers. So we'll see what happens.
Some Democrats said that you were furious. Some of your Democratic colleagues said you were furious that the Stupak amendment is being included. Is that the case?
I was part of recommending that it be come to the floor as an amendment, that both sides are whipping, the pro-choice side and others who want to support the amendment. But no, that was my recommendation to allow a vote on that amendment.
Does the President's appearance make a difference in helping get some of your final votes that you need?
Well, I think it made a difference in helping us come together as a caucus. I don't know that it would do anything about adding to the numbers. We were here today for the President to speak to the whip meeting about the whole issue, and we expect for the energy that he brought to this debate to be helpful to us on the floor. But I have not counted anything about numbers that he would add to it.
Wouldn't that sort of, to some degree, defeat the purpose of the meeting?
I'm sorry?
Wouldn't that, to some degree, defeat the purpose of the meeting?
Defeat the President for doing what?
Defeat the purpose of the meeting to have him up here to maybe help bring across those final...
No, why would that defeat the purpose of the meeting? The President has been with us many times before. This is, my Lord, he's been to whip meetings before, he's been to caucus meetings before. We ask the President to join us whenever we think we need to come together as a caucus and to focus on each other's common agenda.
I just want to make a comment on that. The President came to emphasize how important this is. He campaigned for over a year, and he told the American people, we're going to make health care affordable and available for every American. He came here today to say, this is what we said we will do. Let's do it. We're going to.
Specifically mentioned the Stupak amendment, Madam Speaker.
Okay, there you see the House Democratic leadership walking away from those microphones, having come out of that meeting from the President, and now they gear up for a number of hours of debate.